World Health Day, observed annually on April 7 under the World Health Organization (WHO), highlights global health issues. This year's theme, Healthy Beginnings, Hopeful Futures, underscores the need for equitable healthcare access. A study by Prosper Isahaku Kura, Abraham Marshall Bonbogu, and Abubakari Ahmed in September 2023 examined healthcare accessibility in Ghana, with implications for Sustainable Development Goal 3, good health and well-being. The study found that whilst partial access to healthcare is crucial, most research has focused on primary care, overlooking secondary and tertiary health facilities. The president of the Allied Health Professions Council and lecturer at the University of Ghana, Dr. Shiraz Isahaku, attributes poor healthcare accessibility in rural areas to government's inability to expand medical services.
Healthcare in the country has gone through a lot of challenges. Especially those in the rural environment. They tend not to have access to basic healthcare. Unfortunately, because of that, the few that one we have in the cities are overcrowded. And in view of the fact that most of these challenges are because governments over the years have failed not to expand this access to our rural folks.
The study analyzed access to primary, secondary, and tertiary health facilities using data from Ghana's Upper West region. Findings revealed that 61% of the population can reach primary health care facilities within recommended standards, while 81% have access to secondary care. However, accessibility varies depending on transportation, road conditions, and other barriers. Some Ghanaians shared how readily accessible they receive health care.
Most of the times, they are inadequate facilities and equipment to accommodate some individuals. So when they get to the hospital, they sometimes transfer them into bigger hospitals, which results in some death in other people.
You definitely need to pay something to access the facility or for the doctor to take you through the necessary procedure. And that becomes a challenge for some of us in the country.
I would say it's not really accessible. Not that we don't have facilities, we have, but then finances. Because you go to the hospitals, before you are even catered for, if you don't have the money, it becomes a bit difficult.
For the average Ghanaian, it's very poor. We have not enough doctors, and also I think the facilities are not enough. And even those available are kind of not in good conditions.
Sometimes they delay, actually. Maybe if it's a hospital that has a lot of patients there, like as at that time, maybe they attend someone else, so definitely they won't get a chance to take care of it, but then they will tend to you sometime.
The UN's Agenda 2030 prioritizes good health as pillar of sustainable development. Dr. Isahaku acknowledges government efforts but stresses that more must be done to meet these targets.
As we sit today, we still seem to be a bit far away from this goal that we think that it should be a yardstick that we use to measure where we are. What we need to do is to work towards achieving the objective, and that will be a challenge, even though I believe it is still possible if the current government can put in enough strategies and measures to work towards achieving this objective within the next 5 years.
While healthcare availability is important, disparities in access continue to impact health outcomes. And Yopon Denchi, ABC News Ghana.